Mr. Speaker, I'd like to address the situation of one of my constituents is facing when dealing with Alberta Health and the out-of-country health services application process. After exhausting all options for treatment in Alberta, Mr. Manchulenko, a resident of Highwood, traveled to Germany to have a 3-level M6 ADR lumbar surgery performed. As a result of this surgery, Mr. Manchulenko is pain-free, off medication, and has returned to work. Mike is back at work serving his community as a firefighter and putting his life on the line for all Albertans. The surgery came at a cost of $60,000, so as he's entitled to, he made a claim through the out-of-country health services application process for reimbursement. Unfortunately, what should have been a clear-cut case was anything but that. Mr. Manchulenko submitted his application in September of 2015, and after dealing through all bureaucratic mess, his application was ultimately denied. I've been advocating on behalf of my constituents since he submitted his application, and unfortunately, the health minister has not stepped in to address this issue. In 2018, 2.5 years after the initial application, OOCHS sent the check for $8,000, far less than the cost of surgery. It turns out that he will have to continue to fight to get his rightful reimbursement. Mr. Speaker, there's no reason that this constituent of mine should have to fight for this. He is no longer a burden on the healthcare system. He's off medication, and he's contributing to the Alberta economy again. In fact, the cost of $60,000 the Alberta government is responsible for covering is far less than the cost it would have been bearing if Mr. Manchulenko did not receive the surgery in Germany. Mr. Speaker, I call on the Minister of Health to do the right thing and help in and direct her department to reimburse Mr. Manchulenko for the cost of the treatment of out of country. Thank you.